Great to see everybody here back at Einstein's Eyes, our YouTube channel. I'm Rosen. I'm an oculoplastic surgeon, neuro-ophthalmologist, Anchorage, Alaska. I'm with my friend and co-host, Jon Ditkoff.
Hello, everybody. I'm Jon Ditkoff. I'm a general ophthalmologist in northern New Jersey. Been practicing for over 30 years. It's nice to see Carl. Carl is in Anchorage, Alaska, so we get to see each other once a week when we do these videos. And we have something really interesting for you. I mean, it's not really our specialty. We're ophthalmologists, but we have broken out. We've been talking about a lot of different things. And it's close to our heart since it is from Israel, but I'll let Carl introduce it.
Right. We're going to unpack a remarkable first in Israel. A patient in his 40s, really a remarkable first anywhere, with severe liver cirrhosis. He had a heart bypass and a liver transplant in the same night, and he survived. You can see the image. It's really remarkable. Now, this happened at Hadassah Ein Kerem in Jerusalem during Sukkot as part of a 24-hour transplant marathon that saved 4 lives. Why is this a big deal? Because each of these surgeries alone is very high risk. End-stage liver disease means poor clotting and fragile physiology. There's lab values called transaminases and other things that are just not doing well, and blocked coronary arteries. And a liver transplant by itself would likely fail. The team first rebuilt the blood supply to the heart with bypass surgery, and then hours later transplanted the liver, coordinating multiple surgical teams across hospitals. That level of choreography is rare anywhere. This is an innovation on 2 fronts. This is risk balancing, meaning you fix the heart so it can withstand the transplant, then replace the failing cirrhotic liver so the body can clot and heal. The liver is required for clotting factors. It's a systems engineering issue, synchronizing organ retrievals, anesthesia plants, blood products, perfusion, and ICU beds across sites, all in one night.
During Sukkot.
God, tell us what Sukkot is.
Oh, don't do that to me. Now, Sukkot is kind of a nice holiday. You make a nice thing with outside, and you celebrate the vegetables and the harvest. That's about the best I'll do. But I do get invited every year, and I love it.
Okay, great.
But it was the holiday of Sukkot.
Right.
And
okay,
you guys can chime in and teach me. I'm a nice Jewish boy from Long Island, but you can teach me a lot.
Right.
Give us some good comments.
Right. But it's not just a one-off stunt. In the literature, combining cardiac surgery with liver transplantation is uncommon, but feasible when stage surgery would be too dangerous. Now, the key is multidisciplinary planning, exactly what this team did. In my world, when I do craniofacial repair or facial reconstruction from a bear mauling, we do it in a team approach. I'm the orbit oculoplastic guy. We'll have an ENT surgeon. We'll have maybe an oral surgeon, a plastic surgeon, and possibly a neurosurgeon if the anterior cranial fossa or the orbital roof is involved. So a team approach is vital, much better for patient outcome.
And very difficult because, I mean, surgeons nowadays have such tight schedules. Profit margins are very low. They need to make a living and they're busy and they're pulled in so many different directions. So to get so many doctors in one location, I mean, Israel has essentially socialized medicine. It's different. It would be very tough, if not impossible, to do this in the United States. You do a lot of team approach. I used to when I was younger, but even now, I mean, to get a cataract specialist and a retina specialist together in the same operating room at the same moment is very difficult.
In fact, last week I did combined surgery.
Yeah.
For an endoscopic.
How do you guys coordinate? How do you coordinate your schedule? It's very difficult, right?
Right. It's not easy. It's not easy. So that's why this is impressive. So there's 3 reasons why we should care. So it's proof of possibility for complex patients who used to be too high risk. Coordinated combined surgery can be the difference between no option and a real chance at survival. 2, better use of scarce organs. Now, a liver is scarce, just like a lung is scarce, kidneys less so. Cornea transplant is fairly scarce, but timing is everything. The ability to operate once safely can reduce waitlist deaths and reduce anesthesia adverse events. Multiple anesthetic episodes where you have to space them apart is just not as good as doing everything all at once under one anesthetic roof. 3, the blueprint for the hospitals. This shows how planning and logistics can save lives. A workflow. Businesses do this all the time. Amazon is great at this. Toyota is great at this. Supply chains, making sure everything follows everything else, A to Z. And it saves lives, not just scalpels, but it saves equipment, it saves anesthetic risk, as I mentioned, and it improves outcomes. Something any health system can learn from and should learn from. The headline details are really striking when I saw this at first, and Jon sent this over to me. Bypass finished at around 4 a.m. The donor liver arrived. The transplant started immediately later that day.
Amazing. Amazing.
And the same network completed another liver transplant and 2 kidney transplants. 4 people helped within 24 hours. In summary, this isn't just new gadgets. It's smart teamwork under pressure. It shows what we can do if we appropriately plan, have a great workflow, understand the logistics, and get all the players under one roof in one operating room. This case shows what's possible in cardiac, transplant, anesthesia, and critical care move as one. If you're a patient or a caregiver, coordinated care like this is exactly what you want. We'll keep following innovations that change lives like this in future videos.
I'm going to add something
Jon?
before we leave. The Sukkot. So
Right.
really, the meaning of Sukkot is really this. It's to commemorate 2 different things. The fall harvest that I mentioned. It's to commemorate the Jewish people's wandering, 40-year wandering in the desert after their exodus from Egypt. And that's why you build temporary shelters. I get invited every year to these temporary outdoor shelters that people eat meals in. Sometimes even people sleep in them. We don't in this area, but maybe in Israel. And again, these are my people. I'm really impressed that Israel is doing this in the midst of all this other stuff going on. So it's really impressive.
Right. Well said, Jon. Like I said, guys, short one. We look forward to seeing you again. Please like and subscribe. See you on the next one. Good seeing you, Jon.